Have you ever woken up in the middle of the night with an unquenchable thirst or made multiple trips to the bathroom? Maybe you're struggling to get a good night's sleep or waking up sweaty. These symptoms might seem like minor inconveniences, but they could be signs of something more serious. Diabetes.
Diabetes?
Diabetes is a growing concern in the United States, affecting millions of people across all age groups. According to the Centers for Disease Control and Prevention, CDC, over 34 million Americans, or about 1 in 10, have diabetes. Even more alarming, about 1 in 3 adults have prediabetes, a condition where blood sugar levels are higher than usual, but not yet high enough to be diagnosed as type 2 diabetes. In recent years, the rates of diabetes have been rising, particularly among younger adults and even children. The CDC reports that new cases of diagnosed diabetes have significantly increased among the youth aged 10 to 19. This surge highlights the importance of recognizing the early signs of diabetes to manage it effectively and prevent complications. In today's video, we will discuss 7 vital nighttime signs of diabetes that you should be aware of. By understanding these symptoms, you can take proactive steps towards better health and early diagnosis. Let's dive into the first sign you should look out for: frequent urination at night, also known as nocturia. Let's start with the first sign: frequent urination at night, also known as nocturia. If you wake up multiple times to use the bathroom at night, it could be more than just a tiny bladder. Frequent urination is one of the most common symptoms of diabetes. When blood sugar levels are too high, the kidneys work overtime to filter and absorb the excess glucose. When the kidneys can't keep up, the excess glucose is excreted into the urine, dragging along fluids from your tissues. This leads to more frequent urination, especially at night.
Didn't know that.
Studies show that nocturia can significantly impact your sleep quality and overall well-being. According to research, adults with nocturia are at a higher risk for sleep disturbances, which can lead to daytime fatigue, reduced productivity, and a decrease in quality of life. It's estimated that nearly 70% of individuals with diabetes experience some form of sleep disruption, including frequent nighttime urination, but it's more than just the inconvenience of getting up multiple times at night. Nocturia can also indicate your body struggles to manage blood sugar levels effectively. If left untreated, this can lead to other complications such as dehydration, kidney damage, and an increased risk of infections. To give you an idea of the scale, a study published in the American Journal of Epidemiology found that nocturia affected approximately 29% of men and 28% of women in a general population sample.
Wait, what?
For those with diabetes, these numbers are even higher. This highlights the importance of not dismissing frequent urination as just a nuisance. So, what can you do if you're experiencing nocturia?
You tell me.
Firstly, monitoring your fluid intake is essential, especially in the hours leading up to bedtime. Try to limit beverages like coffee, tea, and alcohol in the evening, as these can increase urine production. Drinking water is essential, but balancing your daily intake is wiser than consuming large amounts at night. Also, consult a healthcare professional if you suspect that nocturia might be related to high blood sugar levels. They can perform tests to determine if you have diabetes or prediabetes and help you develop a plan to manage your condition. Proper management, including medication, dietary changes, and regular monitoring of blood sugar levels, can help reduce nighttime urination frequency and improve overall health. Now let's move on to our second sign: excessive thirst at night, also known as polydipsia. If you wake up with an unquenchable thirst, it could be more than just a need for a sip of water.
He's diabetic.
Excessive thirst is a common symptom of diabetes and is often directly linked to high blood sugar levels. When too much glucose is in the blood, the body tries to eliminate it by flushing it through urine. This process depletes your body's fluids, leading to dehydration. As a result, you need to drink more water, particularly during the night when the body is resting and trying to balance its internal environment. Polydipsia can significantly disrupt your sleep patterns. Imagine waking up several times at night, feeling extremely thirsty, and needing water. This can lead to fragmented sleep and make it challenging to enter deep, restorative sleep cycles. Over time, poor sleep quality can contribute to various health issues, including increased stress, weakened immune function, and impaired cognitive performance. The statistics are telling. According to the American Diabetes Association, around 30% of people with newly diagnosed diabetes report experiencing excessive thirst. Furthermore, research published in the Journal of Clinical Endocrinology and Metabolism found that excessive thirst and frequent urination are among the most commonly reported symptoms in individuals with undiagnosed diabetes. Addressing excessive thirst is crucial for managing diabetes. One effective strategy is to monitor your blood sugar levels regularly. Keeping your blood glucose within the target range can help reduce the symptoms of polydipsia. If you're diagnosed with diabetes, your healthcare provider can work with you to develop a personalized treatment plan, which may include medication, lifestyle changes, and dietary adjustments. In the meantime, there are practical steps you can take to manage nighttime thirst. Avoid consuming sugary beverages, caffeinated drinks, and alcohol in the evening, as these can increase dehydration. Instead, opt for water or herbal teas. Maintaining a balanced diet with adequate hydration throughout the day can help keep your thirst levels in check. Moving on to the third sign, restless sleep and insomnia. If you find yourself frequently tossing and turning or unable to fall asleep, it might be a sign of an underlying issue like diabetes. Restless sleep and insomnia are often overlooked symptoms of diabetes. High blood sugar levels can cause a range of discomforts that disrupt your sleep, such as frequent urination, excessive thirst, and even leg cramps. These interruptions prevent you from getting the deep, restorative sleep your body needs. According to the Sleep Foundation, adults with diabetes are more likely to experience sleep disorders, including insomnia, sleep apnea, and restless leg syndrome. It's estimated that over 50% of people with type 2 diabetes have some form of sleep disturbance. Poor sleep quality not only affects your energy levels and mood, but can also exacerbate diabetes symptoms, creating a vicious cycle. A study published in the journal Diabetes Care found that individuals with diabetes who had poor sleep quality had higher HbA1c levels, which is a marker of long-term blood sugar control. This indicates that managing sleep is crucial for overall diabetes management. Moreover, the American Diabetes Association highlights that disrupted sleep can lead to insulin resistance, making blood sugar levels more challenging to control. Now, here are some tips to improve sleep quality. 1. Establish a regular sleep schedule. Go to bed and wake up simultaneously every day, even on weekends. 2. Create a relaxing bedtime routine. Before bed, engage in calming activities such as reading, listening to soft music, or taking a warm bath. 3. Optimize your sleep environment. Make your bedroom calm, dark, and quiet. Use blackout curtains, earplugs, or a white noise machine if needed. 4. Limit screen time. Before bed, screens' blue light can interfere with your body's natural sleep-wake cycle. Try to avoid screens at least an hour before bedtime. 5. Watch your diet. Avoid heavy meals, caffeine, and alcohol close to bedtime, as these can disrupt sleep. If you continue to struggle with insomnia or restless sleep, it's essential to consult with your healthcare provider. They can help identify underlying issues and recommend treatments or lifestyle changes to improve sleep quality. Now let's talk about the fourth sign, night sweats.
Diego! Sweaty.
If you're waking up in the middle of the night, drenched in sweat, it could be a red flag related to diabetes. Night sweats can occur for several reasons, but when they're associated with diabetes, they often result from fluctuations in blood sugar levels. High blood sugar, or hyperglycemia, can increase sweating as your body tries to regulate itself. Conversely, low blood sugar, or hypoglycemia, can also trigger sweating as the body reacts to the sudden drop in glucose levels. A study published in the journal Diabetes Care found that night sweats and other sweating disorders are common among people with diabetes, particularly those with poor blood sugar control. The American Diabetes Association notes that nearly 40% of people with diabetes experience night sweats, which can interfere with sleep quality and overall well-being. The connection between diabetes and night sweats is significant. When blood sugar levels are poorly managed, it can lead to various symptoms that disrupt your sleep, including excessive sweating. Maintaining stable blood glucose levels is crucial for reducing night sweats and other related symptoms. Here are some strategies to manage night sweats. 1. Monitor your blood sugar levels. Regularly checking your blood glucose can help you understand how your levels fluctuate and make necessary adjustments to your diet, exercise, or medication. 2. Adjust your medication. Consult your healthcare provider if you experience frequent night sweats. They might adjust your medication or treatment plan to manage your blood sugar levels better. 3. Maintain a cool sleeping environment. Keep your bedroom cool and well ventilated. Consider using lightweight, moisture-wicking bedding and sleepwear to stay comfortable throughout the night. 4. Stay hydrated. Drink plenty of water daily to help regulate body temperature and replace fluids lost through sweating. 5. Avoid heavy meals. Before bed, eating large, heavy meals can cause blood sugar spikes that might lead to night sweats. Opt for light, balanced meals in the evening. If night sweats persist despite these measures, it's essential to consult your healthcare provider. Persistent night sweats could indicate that your diabetes is not well managed or that there may be other underlying health issues. Moving on to the 5th sign, frequent headaches during the night. If you're waking up with persistent headaches or experiencing them regularly while you sleep, this could be another indicator related to diabetes.
It hurts!
Headaches during the night can result from various factors associated with diabetes. One primary cause is fluctuating blood sugar levels. Both hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar, can trigger headaches. When blood sugar levels are unstable, they can cause dehydration, electrolyte imbalances, and changes in blood flow, all of which contribute to headaches. According to the American Diabetes Association, people with diabetes are more prone to experiencing headaches due to the impact of fluctuating glucose levels on the nervous system. Research published in the journal Asterisk. Headache Asterisk found that nearly 40% of people with diabetes report frequent headaches, with many of these headaches occurring during or after sleep. Additionally, uncontrolled diabetes can lead to complications such as diabetic neuropathy, which involves nerve damage and can also result in headaches and other types of pain. High blood pressure, another common issue in diabetes, can further contribute to the frequency and severity of headaches. To manage headaches related to diabetes, consider the following strategies. 1. Regular blood sugar monitoring. Monitor your blood glucose levels daily and at night. This will help you identify any patterns linked to your headaches. 2. Maintain a balanced diet. Eat regular balanced meals and snacks to help stabilize your blood sugar levels. Avoid excessive caffeine and sugary foods that can cause fluctuations. 3. Stay hydrated. Drink plenty of water throughout the day to prevent dehydration, which can exacerbate headaches. 4. Manage stress. Stress can trigger headaches and impact blood sugar levels. To reduce stress, practice relaxation techniques such as deep breathing, meditation, or yoga. 5. Consult your healthcare provider. If headaches persist, discuss them with your healthcare provider. They may adjust your diabetes management plan or investigate other potential causes. Now let's discuss the 6th sign, blurred vision. If your vision is becoming hazy or blurry, especially at night, this could be a concerning symptom related to diabetes.
I'm blind! I'm blind! I'm blind!
Blurred vision is a common complication associated with diabetes, primarily due to fluctuating blood sugar levels. When blood glucose levels are consistently high, it can lead to swelling in the eye's lens, causing vision changes. This condition is often called diabetic retinopathy, a severe eye condition that can progress to vision loss if not managed properly. Research published in Diabetes Care reveals that nearly 50% of individuals with diabetes will experience some form of diabetic retinopathy within 10 years of diagnosis. Additionally, blurred vision is frequently one of the first signs of this condition. The American Diabetes Association notes that controlling blood sugar is crucial to preventing and managing eye-related complications. Diabetic retinopathy occurs when high blood sugar levels damage the blood vessels in the retina, the light-sensitive tissue at the back of the eye. This damage can cause leakage or swelling, leading to blurred vision and, in severe cases, permanent vision impairment. To manage and prevent blurred vision related to diabetes, consider these steps. 1. Regular eye exams. Schedule annual eye exams with an ophthalmologist or optometrist. Early detection and treatment of diabetic retinopathy can prevent vision loss. 2. Maintain good blood sugar control. Keeping your blood glucose levels within target ranges can help reduce the risk of eye complications. Regular monitoring and adhering to your treatment plan are essential. 3. Manage blood pressure and cholesterol. High blood pressure and elevated cholesterol can exacerbate diabetic retinopathy. Work with your healthcare provider to manage these conditions effectively. 4. Protect your eyes. Wear protective eyewear when needed and avoid activities that could strain or damage your eyes. Finally, let's address the 7th sign, increased urination during the night, also known as nocturia. If you find yourself frequently waking up to use the bathroom, this could be a significant indicator related to diabetes. Increased nighttime urination occurs when high blood sugar levels cause excess glucose to spill into the urine. This increases urine volume, forcing you to get up several times at night. This symptom can significantly impact your sleep quality and overall health. According to a study published in the Journal of Diabetes Research, nocturia affects up to 50% of people with diabetes. The condition can be particularly troubling because it disrupts sleep, leading to fatigue and decreased quality of life. The American Diabetes Association also highlights that managing blood sugar levels is crucial for reducing symptoms of nocturia. Frequent nighttime urination can result from poorly controlled diabetes, where elevated blood sugar levels lead to excessive thirst and subsequent increased fluid intake. The body attempts to expel the excess glucose through urine, leading to more frequent trips to the bathroom. Here are some strategies to manage and alleviate increased nighttime urination. 1. Monitor fluid intake. Limit fluid intake in the evening, especially before bedtime. Try to drink most of your fluids earlier in the day. 2. Manage blood sugar levels. Work with your healthcare provider to control your blood glucose levels. This can reduce the amount of glucose in your urine and decrease the frequency of urination. 3. Avoid caffeine and alcohol. These substances can act as diuretics, increasing urine production. Reducing or avoiding them, especially in the evening, may help manage nocturia. 4. Elevate your legs. If you experience fluid retention during the day, elevating your legs in the evening can help reduce the amount of fluid that returns to your bladder at night. If increased nighttime urination is persistent or bothersome, consult your healthcare provider. They can help assess your condition and provide guidance on managing your diabetes effectively to improve your overall quality of life. Recognizing these 7 nighttime signs is crucial for managing diabetes. If you experience any of these symptoms, seeking medical advice for proper diagnosis and treatment is essential. This video is for informational purposes only and should not be considered medical advice. Always consult with a healthcare professional for personalized guidance and treatment options. Managing diabetes effectively requires a comprehensive approach, including regular checkups, lifestyle adjustments, and adherence to medical advice. Thank you for watching. If you found this video helpful, please like and subscribe for more health tips and information. Stay tuned for our next video.